Orthopaedic Research UK is an independent medical charity and one of the significant funders of orthopaedic research in UK. We support all areas of research in orthopedics and musculoskeletal pathology, from rheumatoid arthritis through to back pain to delivery of trauma care in both civilian and military settings. We know that there are a significant number of military personnel who have suffered from orthopedic conditions after blast or combat injuries. It's an area where more translational research is desperately needed in order to improve the quality of lives of so many men and women who have served their country so bravely. We want to encourage researchers to be innovative and are keen to promote collaboration and partnership across scientific, medical and academic communities in order to be able to deliver outcomes that would produce real benefits for patients.
This year, the combination of trauma innovations with Orthopaedics Research UK has allowed us to expand the conference slightly. Day one is really an instructional style course looking at understanding ballistics and blast injury. The idea of this is to focus on the principles affecting ballistic and blast injuries, so that initially we're going to have mini symposiums on ballistic injury and blast injury. This will be followed by overall general management of these types of injuries in the afternoon, and moving on to the rehabilitation and a very tiny aspect on mental health. But overall, it hopes to provide really the whole patient journey and understanding of these type of injury mechanisms. On day two, we're looking to the more academic side and what the Defence Medical Services, in collaboration with a multitude of partners, have managed to advance in the last year to 18 months. This allows us to look at all aspects of trauma, but in particular this year we're looking at both before and after the injury pattern. Now, and this is why this year it's called Left and Right of Bang. Left of Bang means before the injury, so we're looking at protective mechanisms, vehicle mitigation systems, personal sensing mechanisms for physiological monitoring pre-injury, and then afterwards, post-injury, looking at outcomes and how we identify key areas and key outcomes earlier in the patient's management.
We believe more research is required in this rather understudied group of patients. At the moment, we are so proud to be sponsoring a research project currently at the University of Birmingham, looking at innovative approaches for the prevention and treatment of heterotopic ossification. It's early days, and we are keenly looking forward to finding out the outcomes of this very exciting research.